SILS hysterectomy, SILS stands for single incision laparoscopic surgery. And basically a SILS hysterectomy is a laparoscopic procedure that's done through a single incision using a specialized port in the umbilicus. It's the very minimally invasive way of doing a hysterectomy. SILS hysterectomy is technically more difficult as far as compared to robot or straight stick laparoscopy. SILS involves the single incision using a specialized port. The advantage is clearly to the patient because it is a single 1-inch incision which is in the umbilicus, and so the cosmetics after healing are superb. SILS hysterectomy patients, just like most other minimally invasive hysterectomy patients, have a very speedy recovery. Typically it involves an overnight stay in the hospital and 10 to 14 days of recovery time at home before returning to work. I've been very happy with SILS. The patients seem to really love it. It's neat to see a patient come back to your office in a week for their first post-op check wearing regular street clothes, maybe out running errands even. So yes, I do see myself doing more of these even in the future. SILS is a nice tool to have in the arsenal of minimally invasive procedures, in my opinion. Some of the more complex cases, I may need to use a robot or straight stick, what we call multi-port laparoscopy. Some surgeries where the case may be a little bit more straightforward are great candidates for SILS because all the instruments have to go through the single port. So even though not all patients are candidate for SILS, certainly there are a lot of women who will benefit from that procedure.